Hello everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Midwifery Business Consultation. I am excited about these next couple presentations I have. Midwifery scope of practice is a really important one. When I talk to a lot of midwives that are starting practices or wanting to get hospital privileges, it really is important we understand our scope of practice. If there's aspiring midwives out there, it's a little overwhelming understanding all the educational pathways. So I wanted to put together a presentation. You'll find there's files attached to this course that have to do with state-by-state details because it is so overwhelming, and I wanted to simplify it as much as possible. So all of my presentations at the beginning, we have a legal disclaimer. I'm not an accountant. I'm not a lawyer. You always need to talk to your local expertise. Things change all the time. When I'm doing this recording, I try to keep our information as accurate and timely as possible, but I want you to always do your due diligence and look at your local area's needs, standards, and what your current situation is. So the objectives with this presentation, I want you to really understand the difference between the midwifery standards in the United States. I want you to be able to confidently educate the public, your neighbor, about the different types of midwives that are out there. What are the scope of practice for the different types of midwives? What does the different training pathways look like? And have a good sense of each state's guidelines, and especially in your local area. You want to be very confident that you understand what's regulated, what's not, what can be done by certain midwives in your area, and what can't be. So why is it so important? I can't stress this enough because we want as midwives to be the most autonomous, to take care of low risk healthy women, to be able to be part of the integral healthcare system. And if we don't really even ourselves understand our scope of practice and our local regulations, how are we going to expect consumers, community, legislature to understand what midwives are, what we can do, and what our potential is? So it's really, really important that midwives get a good sense of our care standards, our training, our competencies, and how we can really better our local communities. So these are a list of a lot of great resources that you can go to, and I definitely have attached to the course a handout that talks about all these places. So there's international guidelines, there's national guidelines, there's state guidelines, and then there's more of that gray zone where there's really nothing to reference in your area. So being able to go to these different boards, these different guidelines, these different resources we have available to us will really help defend you, really help concrete what we can do safely in our area as part of our licensure, part of our training, part of our standards of care, and what may put us at risk that we just don't realize. If there is that rare bad outcome, there is a transfer, there is a board wanting to evaluate, are we practicing medicine without a license? You want to be able to defend yourself. So this is from MANA, the Midwifery Model of Care. I'm just taking it a very high level overview, assuming there's some aspiring midwives on here thinking about joining this pathway, or maybe there's some consumers that just want to learn more about midwives and birth centers. So Midwifery Model of Care, it really is fundamentally different than the traditional obstetricians, the traditional medical model that's present in the United States. We approach things with more of a physiological, preventative, normal process, and we have the skills and training to take care of those rare emergencies if they occur, and when to deviate to get transports, to get additional resources from higher acuity facilities. So it's really about prevention, it's about informed consent, it's about autonomy, it's embracing a normal process and being, I would compare it to a lot of my consumers. I'm the lifeguard at the pool. I'm the one that has the knowledge, the resources, the expertise you can go to. I bring my equipment to the birth setting. I bring my team. I bring my knowledge and skill set to make sure everything continues as a normal birth process. There's so many different types of midwives out there. So our society barely knows what midwives are. On top of, there's so many educational pathways. Plus, there's 50 different state regulations. And so that's why it gets so confusing. And I know that the national organizations and state organizations are working really hard to get more consensus and congruity among these regulations so that we can be represented more as a strength versus there's just too much gray zone of what's going on in each person's needs and situations. So with the midwifery model of care based on MANA's definition, the core model is really keeping a close eye. Assessment skills are really important. We look at the mind, body, soul of a childbearing aged woman. We look at from the age of when she gets her first menstrual cycle all the way till postmenopausal. Most midwives focus on the obstetrical side, but there are, as you'll find out, nurse midwives do full scope women's health care. We can do primary care, we can do gynecological services. So there's definitely, depending on if you're considering becoming a midwife, understanding really well what can a nurse midwife do, what can a certified midwife, a certified professional midwife, a direct entry midwife, a lay midwife, all these different terms, what can each one do based on their training and skill set. So providing individualized care, providing preventative, that quality versus quantity, which is so hard in today's high-paced medical system, we really are about one-on-one support, about really giving low interventions and high quality care. We are really good at our knowledge and skills and assessment of determining, yes, this woman needs additional services that I cannot do part of my scope. Yes, this baby is breech. We should consider going to the hospital. There's twins on that first trimester ultrasound. There's certain variations of normal that start to go into that high risk category based on national and state regulations. So you want to be sure you understand, you're creating your policies with your practice, you're working for someone else that has a really clear guideline that's consistent with your state and national regulatory scope. So the big thing with midwifery model is it's women centered, it's woman empowerment, it's helping to reduce the trauma, improving that she's delivering the baby, you're not the one that's really participating as part of her birth process. We're being invited to be part of her team. We are not in control of the situation. And this is a little different. The ACNM guidelines, the American College of Nurse Midwives, has the midwifery philosophy of care. And so this is more directed towards nurse midwives and certified midwives, but I still thought it would be good. The first one with MANA tends to be more the philosophy and the core competencies of certified professional midwives and direct entry midwives. So with the American College of Nurse Midwives, it really stresses basic human rights, not doing harm. We want to give respect. We want to give accessibility. We want to give high quality, cost-effective care that's culturally inclusive. We really want to empower women and their families to make the decisions. It's informed care. It's not about us making the decisions for that family because every situation is different. So lots of preventative time, a lot of education, a lot of counseling so that we can help them make the best decision for them. So we focus around the best model of healthcare for a woman and her family. So most of what midwives do and is looked at on a national standard is the prenatal care, the birth, the postpartum care, the newborn care, the first month of life. But I always challenge midwives, especially if they're considering starting a practice, to utilize the full scope of what a midwife is. So a lot of certified midwives and certified nurse midwives do full scope. They can do primary care, they can do the newborns, they can do birth control. There's so many services we can offer as midwives. So the core philosophy has to do with good communication, appropriate interventions when needed, collaborating, working closely with the healthcare system. It doesn't mean we are in a more hierarchy. It's more we're all part of a team. I always stress, like a family practice doctor, they're not the expert in everything, but they don't have an obstetrician, they don't have a dermatologist over top of them. They just work closely with one another. And some states are better at that than others. So we want to really affirm that it incorporates a well-served midwifery education. We want to make sure we're giving evidence-based care. We want to keep up with our skills, our competencies, attending conferences, reading up to date, practicing our skills, keeping our ACLS, our NRP, our certifications up. Even part of the midwifery certifications, all of them that I'm aware of, that are more structured in the system, you have to have continuing education to renew your license. So you want to make sure that you're always being an integral part of the community. We want to promote normalcy. We want to practice within our scope and keep our training up. So this is a really nice map to reinforce the places where more midwives practice. I practiced in multiple states over the last 10 years, and it's really interesting just to see the cultural diversity on top of the differences of how women birth, but also how the healthcare system supports or looks at the scope of midwives. So definitely the southern states, it tends to be a little more restrictive. The Midwest is a little more vague. The East Coast, there's definitely more midwives. You'll see in New Mexico and a few other states, it's kind of hit or miss. The more progressive a state is, it tends to have more midwives. It tends to have regulations that are more in favor of midwifery autonomy, owning their own businesses, practicing independently, independent prescription rights, more part of the team versus you are underneath a physician's more of that physician assistant role. So it's definitely interesting. We have a long ways to go when 70 to 80% of our population is low risk and can be caught by a midwife. To see it ranging between under 7% to 14%, I feel we have such an opportunity the next 20, 30 years to really get awareness. But until we get consistency of understanding a midwife, consistency in more regulations, and it's going to be very, very difficult. So as we were talking about midwifery regulations, we have to worry about international certifications like with MANA, NARM, the North American Registry of Midwives. So certified professional midwives, it's tricky because some states regulate them, as you'll see on the list. Direct entry midwives, certified professional midwives are regulated in 31 states, while the other 29, they have more of that gray zone of they have to be more careful of, are they going to be accused of practicing medicine without a license, or is it very restrictive saying they cannot practice there? Certified nurse midwives tend to have the most autonomy based on they can practice in all 50 states. They tend to be recognized more in the medical community. Physicians' offices tend to hire nurse midwives versus certified professional midwives, and direct entry midwives tend to start their own private practices and are more out of hospital birth setting. Certified midwives are very similar to nurse midwives. The undergraduate schooling is just a tad bit different. So nurse midwives have an undergraduate in nursing, a bachelor's degree typically, and certified midwives can have another degree, usually in some form of science, but I've known a few great certified midwives that have an undergraduate in art. So the big thing is certified nurse midwives and certified midwives have the same graduate programs. So a lot of my colleagues, when I went to school, were that different path. The challenge is with certified midwives, it's only regulated in 5 states. So you are really restricted where you can practice at this point. I know there are, every year we're getting more regulations, we're getting more consensus, we're pushing more for autonomous safe practice. So you definitely have to do some research. If you're thinking about becoming a midwife, you first have to look into the different educational pathways. What are the pros and cons? What's based on your philosophy? How do you want to practice? Then you have to look at, where may I practice? Where do I live? Where may I live in the future? And is that a midwifery friendly state? And it's hard because you say maybe now it isn't, but I'm going to practice the next 20, 30 years. And so it's very tricky for midwives that are considering starting practice, and for consumers that are considering hiring a midwife, it's very overwhelming. So it's really important to get involved in legislature, state affiliate programs, and help change the access to midwives, and to be able to get more of a mass marketing consensus, get more recognition. You want to be able to have not restrictive regulations, you want them to be to the full extent of your educational skills and training. And then the part that I'm just adding now, but I really want people to think about, just because there's state regulations does not mean a hospital has to follow them. The hospital is a private entity, just like if you go to a restaurant, you go into a store, they're a business. So they can choose to make their own hospital privileges, their guidelines, more conservative than the state regulations. So you've got international guidelines and resources, you've got national, you've got state, you've got the local hospitals making their own rules. And so sometimes it makes it very difficult for the nurse midwives trying to participate part of the bigger medical system, because every layer tends to make things more restrictive and conservative in practicing model. So midwifery scope based on the credentials. We've already talked high level. Certified nurse midwives tend to be the most popular in the United States. They tend to be in the hospital settings. There's quite a few that do home birth and birth center, but the vast majority work closely, either being employed by a hospital or physician, or working as a laborist, working in a private practice. They sometimes will start their own businesses if their state allows that. There's a few states that don't allow nurses and midwives to own businesses, so it is kind of frustrating to know your scope and know, well, I want to move closer to family, but midwifery guidelines in that state is so restrictive. If I want to practice like the midwife I want to be, now you're putting those challenges at this current point of, do I move where I love the type of midwife I can be, or do I be more restrictive of a midwife and not why I joined this profession, but I can be closer to my family. So definitely look at the states, and every state is different. Some have full practice autonomy and some are very restrictive and require collaborating relationships. Especially if you're considering starting your own private practice, it's not just about looking where you can get a job at being employed, it's also, how am I going to be successful short-term and long-term running my own private practice? What hurdles, what barriers do I need to get over? Certified midwives are very similar to certified nurse midwives. The undergraduate schooling is just not in a bachelor's of nursing. Unfortunately, at this point, there's 5 states that recognize it, and slowly we're getting more and more. So that's the big challenge. If you choose the educational path of a certified midwife, you have to look at the 5 states that are currently regulating, and is that somewhere you want to live? Direct entry midwives and certified professional midwives, it's more of an international training. It's more of an apprenticeship model. There's not as much structure and educational restriction of the programs of what your training and competencies will look like in the end. It's an international certification, and some states actually have their own state education programs that you have to follow a minimum curriculum or a state examination board to be able to practice. So every place is different. And the places I stress are where there aren't state regulations to recognize direct entry midwives and certified professional midwives. You're putting yourself in that gray zone of illegal. It's not illegal, it's not legal. You're in that gray zone of, do you want to be the first one that they test? Can this be done in the state or not? Are you practicing within a scope that doesn't really have regulations in that state? So it has to know your personality. Are you more of a risk taker? Are you more conservative? You want to do things by the book? Will really dictate what kind of educational pathway and training you would like to do. So we talked about it. There's different educations. So there's associate's degrees, there's bachelor's, there's master's. To be a certified nurse midwife, to be a certified midwife, it's a master's degree. To be a certified professional midwife, there's all 3 different levels. You can get an associate's from some of the programs, some are bachelor's, some are master's. Licensed midwife more means in that state you have a license to practice within there. The direct entry midwife sometimes will do an educational program, but it tends to be more more of informal apprenticeship, more of a self-paced. There's not as much examinations. There's not as much core competency levels of expectations. So it just depends on the style of midwifery you want to learn from, and more of that apprenticeship preceptor model versus an actual school traditional structure. Certified nurse midwives, most of them are registered nurses and then will transition to get a master's. There's some programs that it's a master's in midwifery, and some programs it's a master's in nursing. And it's very interesting because even the degree, there's a couple states that you can't practice in purely because you have a master's in midwifery versus it's called a master's in nursing. So you really have to do a lot of research. Where do you want to live now, and where do you potentially want to live in the future? And right now, can you practice in that state? So most of the time, if you're like, I want to do birth center, I want to do home birth, I want to start my own private practice, you can do it as a nurse midwife. It's just not as common. There tends to be more of the medical training, more of the medical collaboration, integral part of the healthcare system. So they tend to be more in the hospitals and physicians' offices. Not to say you can't, I'm just explaining the kind of trends that I see across the country. Certified nurse midwives are low risk independent care providers, but they tend to do additional training and scope as higher risk. They can do gynecological procedures, they can assist with C-sections, they can do colposcopies. There's a lot more medical training that you can get to be part of that system. I've seen many midwives that work at perinatologist offices at high-risk facilities, and they do certain parts of the care to keep more the social, the low-risk aspect. So there's so many possibilities out there with certified nurse midwives, and at this point, with being recognized in all 50 states, you tend to have more autonomy if you're thinking you want to travel a bunch. So this is a good map to talk about the different practice environments as of 2018. So obviously things can change the last 3 years. And COVID has really put a change in everything because there was so much federal relaxing of nurse practitioners and physicians assistants because of the medical emergency. And so every state is different and things are constantly changing. So you definitely want to just look at your local guidelines and what are the current trends. But it gives you a good sense. Like the green is the independent practice, so as of this point 27, and then the one that has kind of the hashtag green is a hybrid model. They're not completely independent, there's some level of collaboration and writing that's needed. The ones in red are collaborative agreement required for prescription authority and some level of dependency on the system to be able to practice. So if you can't find a physician to work with and one that won't sign that collaborating relationship, you now have a certain part of your scope. It's very difficult as nurse midwives to feel like we can practice safely without ordering prescriptions. If there's something going on, it's always that catch-22 of we want to be able to work closely with families to get them the best care possible. And so if you're not able to get those collaborating agreements, it makes it very difficult. Collaborating arrangements are required in 12 states, and our goal, as you'll see in future conversations, there's a lot of national organizations that are pushing for advanced practice registered nurses to have more across the board consensus, consistency, and more autonomy. So I think we're going to continue to see more and more of this map being put to that bold green independent practice, which is my dream and my love, to see more midwives, more nurse practitioners being able to have private practices, autonomy to the full extent. I think we're going to really improve the quality of care and the outcomes in the United States. Certified midwives, there's not as many programs. I had a really hard time finding which programs, without digging and digging, do certified midwives. I know at Jefferson University, where I went, they do that, and there's a few others. But the challenge is there's just not that many states to practice in right now, so that puts a barrier to you. Direct entry midwives, certified professional midwives are more an apprenticeship model, and some states regulate them, some states don't. Certified professional midwives and direct entry midwives tend to pretty much do OB pregnancy care. Certified midwives, certified nurse midwives tend to do full scope woman care, primary, postmenopausal, newborns the first month of life, additional medical procedures. So certified professional midwives, I would say in the home birth, out of hospital birth center setting, most of the midwives practicing are certified professional midwives across the country. So if you know you want to run your own private practice, you want to have this little boutique home birth practice, you can be a certified nurse midwife, but it's more popular for the educational pathway to be a certified professional midwife. So this is a really exciting consensus model that's coming out with APRNs, Advanced Practice Registered Nurses, to get more autonomy. And I think certified professional midwives and direct entry midwives are going to be able to benefit in both directions, because as we get more midwifery boards, right now there's a lot of states where if you choose to be a nurse midwife, you may have one license in nursing and then you'll have a separate license as a midwife with that board. But many states, they're all grouped together. It could be the same license, it could be a post certificate. And so then you get into this challenge of, are you practicing as a nurse right now, or are you practicing as a midwife? If there's a bad outcome and something happens, you've got these muddied scopes of practice together in your educational background. So it's definitely exciting to see that advanced practice registered nurses are getting more of a distinction, that postgraduate, those certificates, those accredited programs are completely separate from your nursing skill set. So I'm all on board for independent practice, for independent prescribing, independent insurance reimbursement, business ownership. The more autonomous we can make midwives in the United States and the more consistent we can make the state regulations, it's only going to benefit midwifery more and more. So this is a really helpful map, and it's pretty recent. Just a few months ago it's been updated, and there is attached to this course, and I put a little link attached of what do these points mean. So pretty much the lower a point is, the more restrictive, the harder it is to practice it as an advanced practice nurse, and then the 28 points is like the highest level possible. So you can see the trends that are going through the United States. It's really interesting to see Florida, Alaska, Oregon, the central United States tend to be pretty autonomous for advanced practice nurses. Far to the East Coast, the Midwest tends to be gray. There's that band of southern strips of states. So if you want to run your own business, looking at this map, and you could go anywhere in the country, you may be not so inclined to go to Alabama, go to Tennessee, Pennsylvania, or New York at this point, because that's one of the more restrictive practices for you to be able to do your scope to the full extent. So practice autonomy, I talked about this over and over again. Whatever route of midwifery care you want to do, I want us to be able to practice to the full scope of our midwifery skills, education. I don't want barriers of, now we can't get insurance reimbursement, now we can't start our own private practice, now we can't do prescriptions, now we can't order ultrasounds in labs, and it goes on and on and on. If we're restricted in our education, our scope, it's not going to improve outcomes. It's going to make it harder to access midwives, to start our own businesses, and to be profitable and long-term, not burning out because of all these barriers. So I'm a huge fan of the consensus model for really trying to expand. Right now it's more focused with this organization on APRNs, but I think it's going to help everybody. If we can get more autonomy for nurses, more autonomy for midwives, it's really going to help out our healthcare system and what families have to access. So the educational requirements is just trying to get a little more consistency, because right now, as you know, with midwives, there's 4 or 5 educational pathways. There's international certifications, there's national certifications, there's state regulations and licensing continuing education requirements, and there's hospital privileges making their own rules. So if we can get more consistency in the educational requirements, it's going to make it easier to communicate and to make changes in each of these local areas. So I just want to summarize everything we talked about. I am so excited to be able to be part of the change and give more access to midwifery care. It's not the cultural norm in the United States. It used to be, and so my passion and my drive is to get awareness to midwives that are currently practicing, the ones that are just starting out, the ones that are thinking about becoming midwives. How do we improve resources and access to our care that we can now practice to our full extent? So definitely understanding the different pathways, understanding your colleagues. If you're one type of educational pathway and they're a different credentialing, it's really important for us to understand what each midwifery scope can do and what are our state regulations right now and how do we advocate to change those if it's not to the level we want. So if you're considering becoming a midwife, this is the step-by-step I help aspiring midwives with. Just look at yourself, look at what type of midwife you envision being. Do you envision being more in the hospital? Do you envision being more in the birth center home? Do you envision being in Alaska versus Florida versus Ohio? Like, you need to have a sense of what type of midwife and where do you want to practice, because a midwife that takes care of the Amish in Pennsylvania is going to be very different than the midwives in New York City in a high-risk antepartum unit. And so you want to understand what type of midwife you want to be and learn the different educational pathways and which one makes the most sense for you. So if you don't have a nursing degree and you're thinking about becoming a nurse midwife, do you want to be in school for 6 to 8 years? Versus if you choose to be a certified professional midwife, direct entry midwife, it's 3 to 5 years. So there's a lot of things to think about. If you're already a nurse and you tend to want to be in the hospital setting and you work around a lot of nurse midwives and you like the flow of the structure, the salary, the office call setup, it makes more sense for you to go back to school for a nurse midwife. So you just have to think about it, and I'm more than happy to talk to anyone that's considering becoming a midwife or is considering moving to another state, considering starting a practice. There's a lot to think about because we want to make sure you're protected. You understand clearly what your scope is, not just from your educational training, but what that local regulatory board says is your scope. Here's some references just to look over, but definitely just reach out to me if you have any questions, and I can't wait to see the next 10, 20 years where midwifery is going to go in the United States.